Asepsis, the prevention of contact with microorganisms. The concept of and rationale for sterile surgical technique in the hospital is not questioned. It should therefore be incumbent upon each of us, as responsible clinicians and assistants, to provide as favorable an environment as possible for our dental implant, periodontal, and other surgical procedures. Surgical scrub technicians are responsible for developing and maintaining a sterile operating field and aseptic room. Similarly, as you will learn in this program, it is the dental assistant's responsibility to duplicate as closely as possible the hospital operating room environment in your dental operatory, and to maintain an unbroken chain of sterility. The first step in preparing your dental office for surgery is disinfecting the surgical room. It is best to designate one room for use as the surgical suite. A germicidal such as Vesvine should be used to clean all surfaces in the operatory. All exterior surfaces should be cleaned after each patient. If the room is used for general dentistry, it should be cleaned thoroughly before a surgical procedure. The floor must be mopped, the dental chair wiped, and the operatory light cleaned. The inside of cabinets and drawers should also be cleaned every 2 months. To create a sterile field, the patient and other non-sterile areas and items must be covered using sterile drapes. The drape pack consists of 2 light handle covers, 1 suction cover, 1 handpiece cover, 2 small face towels, 1 large patient towel, 1 instrument table cover, and 1 patient drape. The instrument table cover is folded with a cuff to facilitate draping. The patient drape is folded from the sides towards the center opening, which will fit around the patient's mouth. The ends are folded up towards the center opening, leaving it exposed for easy patient draping. All items must be double wrapped in autoclavable paper and sealed with autoclave indicator tape and labeled and dated with an indelible marking pen. Items should be packaged in the order they are used. The large towel first, then the patient drape, 2 small face towels, handpiece, suction, and light handle covers, and the instrument table drape. Start with the corner towards you, fold it up and leave a tab. Fold the sides up and leave tabs. Tuck the top together to form a triangle. Fold it up, over, and tuck the tab under. Fold the second drape the same way as the first, starting with the corner towards you, then each side, fold the top last, and tuck the tab under. Tape the package with autoclave indicator tape. And label and date with the indelible marker. Non-sterile persons participating in surgery must wear sterile gowns and gloves. Grasp the gown by the shoulders. Fold the back to cover the front of the gown. Lay the gown flat. The sleeves and ties are now on the inside of the folded gown. Fold the sides towards the center. And the bottom to the neck. The gown is now folded so that only the inside is handled when gowning. The gown pack consists of several gloves with large folded cuffs, the folded gown, and a towel for drying your hands after scrubbing. The gown pack is folded in the same manner as the drape, starting with the corner towards you first, then the sides, and then the top. Always remember to leave a tab for easy opening after the package has been sterilized. Seal your package with autoclave tape, label, and date with the indelible marker. Place instruments in a towel before wrapping to prevent sharps from perforating the paper wraps. Wrap in the same manner. Tape, label, and date your package. Place bone cup upside down in the center of the paper wraps to facilitate wrapping. Wrap the package as indicated. Tape, label, and date the cup. Extra gloves are wrapped for prepping and in case of accidental contamination. Make sure the gloves have a wide cuff. Wrap as indicated. Tape, label, and date the gloves. Small items, such as a handpiece, can be double peel packed. After sterilization, they have a shelf life of 6 months, after which they should be re-sterilized. Care must be taken so that sharp instruments do not perforate peel packs. Label and date the peel pack. The Alice clamp and 2x2 sponges used for prepping only can be single peel packed and have a shelf life of 1 month. Label and date the prep pack. In the dental office, there are 3 ways to sterilize items: steam under pressure, the glass bead sterilizer, or cold sterilization with glutaraldehyde. Place wrapped packages and peel packs loosely in an autoclave pan. Place items in the autoclave. Check the water level in the autoclave and close the door. Set sterilizer. 30 pounds of pressure, 270 degrees for 30 minutes. Vent the autoclave. Open the door after the pressure is released. Open the door slightly and let the items dry in the autoclave for 30 minutes. When items are dry, they should be completely cooled before placing on a shelf to prevent condensation and contamination. Rotate your stock so that sterile items are used before they outdate. They should be stored with other sterile items. Never store near unsterile supplies or liquids to prevent accidental contamination. Items double wrapped in spun-guard paper have a shelf life of 2 months. Check the date and indicator tape before using. Items double peel packed have a shelf life of 6 months. Check the date and indicator before using. Items wrapped in linen or cloth have a shelf life of 1 month. Check the date and indicator before using. A glass bead sterilizer is adequate for small items such as burrs and implants. A heat-resistant cover is used to keep the sterilizer from being contaminated when not in use. 7 seconds at 233 to 246 degrees centigrade is sufficient to achieve sterility. Pick up the item with a cotton plier. Immerse the item and the pliers in the bead sterilizer for 7 seconds. Remove the item, being careful not to touch the unsterile side of the sterilizer, and drop the sterile item onto the sterile field. Items that cannot withstand the high heat of autoclaving, such as anesthesia carpules and a prep brush, are soaked in a glutaraldehyde solution for a minimum of 10 minutes. Items must be thoroughly rinsed with sterile fluid or wiped with a sterile 4x4 before being placed on the field. After supplies have been sterilized and the room has been properly cleaned, you are now ready to prepare the patient for surgery. Items used for the patient prep are the prep pack, an Alice and 2x2 sponges, a prep cup, sterile prep gloves, a sterile oxygen cannula, glutaraldehyde solution for soaking the toothbrush, sterile water for rinsing the toothbrush, betadine solution used to prep the mouth and face. Check dates and indicator tape before opening packages. Remove tape. Open package one corner at a time by grasping onto the tabs. Fold the sides under. Never reach over your sterile field. Open, holding only the tabs. The edges of the package are not considered sterile. Grasp both sides of the peel pack and peel apart. Place item over sterile field and drop supplies onto sterile field. Open the glove package in the same manner as the prep cup, grasping only the tabs. Fold the sides under. Never reach across the field. Pick up the sterile glove by the cuff. Slide your hand into the glove while holding on to the cuff. Take the gloved hand and slide under the cuff of the sterile glove. Slide hand into the glove while the sterile hand remains under the cuff. With sterile gloves on properly, you are now ready to begin the prep. The circulating assistant will pour the betadine into the sterile cup, being sure that the non-sterile betadine container does not come in contact with the sterile prep cup. A toothbrush which has soaked in the glutaraldehyde solution for 10 minutes and is now sterile must be thoroughly rinsed with sterile water. The patient is in a supine position and a patient bib is in place. Their hands are restrained to prevent them from accidentally contaminating the sterile field. Place a folded 2x2 on the Alice clamp. Saturate the sponge with betadine. And begin the prep by swabbing the inside of the patient's mouth. Swab all mucosa in the patient's mouth, their teeth, making sure to swab underneath their tongue and the tongue itself. Next, dip the toothbrush into betadine and thoroughly scrub all the patient's teeth to remove any excess plaque or debris. Swab the mouth again to remove any debris from the brushing. Swab 2 or more times depending on the patient's oral hygiene. Start the face prep at the lips and work outward, scrubbing in a circular motion. Never go back over an area that is already prepped. Work in an ever-widening circle. Prep the inside of the nostrils. The oxygen cannula will be placed there. Care must be taken not to get the betadine solution in the patient's eyes. A second application may be needed if there is heavy lipstick or makeup on the patient's face. The circulating assistant peels open the oxygen cannula. Care must be taken not to touch the edges of the package. The sterile prongs are placed in the patient's nose. The tubing runs behind the patient's ears. Once your hands touch the ears, they are no longer sterile, and you must not touch the patient's face. The two types of antibacterial soaps recommended for surgical hand washing are betadine soap and hibiclin soap. Remove all jewelry, rings, bracelets, watches prior to the scrub. Adjust your cap and mask before you start to scrub. Rinse your hands with water and apply the antibacterial soap of your choice. Start with your hands. Pay particular attention to the areas underneath your nails and between your fingers, as these areas have the highest bacteria counts. Wash your arms, starting at your wrist and working your way down your arm towards your elbow. Rinse your hands after washing your arms. And scrub your hands again. The surgical hand washing should last approximately 3 minutes. When rinsing, start at your fingertips and let the water flow down your arm towards your elbow. Keep your hands up, letting the water flow from the clean area, your hands, towards the unclean area, your elbows. The circulating assistant will open the gown pack for the surgical assistant. The pack consists of 1 towel for drying your hands, 1 gown, and several gloves. The surgical assistant will grab the towel, taking care not to drip on the sterile contents. Starting with one hand first, completely dry your hand. Work your way down the arm, starting at your wrist and ending at your elbow. Never go back to your wrist. Use the opposite end of the towel for your other hand. When you reach your elbow, discard the towel. Carefully grasp the gown, being careful not to contaminate the gloves beneath it. Let it drop open and slide your arms in the sleeves, being careful not to let your hands extend past the cuffs. The circulator will then tie the gown, being careful to touch only the inside of the gown or the strings. Pick up a sterile glove with the hand inside the sleeve and place it on the other hand that is still inside of the sleeve. Place the glove thumb to thumb, cuff to cuff. Pinch both sides of the cuff and pull the glove over the cuff of the gown. Slide your hand into the glove. With the gloved hand, pick up another sterile glove and place on the other hand, thumb to thumb, cuff to cuff. Again, pinch both sides of the cuff, pull the glove over the sleeve cuff, and slide your hand into the glove. While the surgical assistant completes her scrub, the circulating assistant opens the sterile drape and instrument packs, grasping only the tabs, starting with the top first, then unfolding each side and the bottom corner, never reaching across your sterile field. Open the instruments in the same manner. The surgical assistant enters the room and begins to prepare the sterile surgical field. She will first drape the unsterile instrument table with the sterile instrument table cover. Keeping her hands under the cuff of the cover, she pushes the cover on the table. Next, she places her sterile instruments on the table. Handpiece and suction and light handle covers. Keeping her hands under the cuff of the small face towel, Place one over the patient's eyes with her hands under the cuff. Place the second one under the patient's chin. The two towels are secured together with towel clips. Care is taken to avoid contacting the patient with the clip. Next, we place the patient drape. Place it over the patient's mouth with the small end towards the patient's head, the large end towards the patient's feet. Place your hands underneath the folds to avoid contaminating yourself when unfolding the drape. Place both hands underneath the folds and unfold the drape towards yourself first. Then unfold the side opposite you, completely covering the patient. The large towel is placed across the patient's chest. Suction cover, the end is dropped. The circulating assistant places the unsterile suction tube inside the sterile suction cover. Secure the cover at the top with a sterile rubber band. Place the sterile suction tip in the sleeve. The bottom of the suction is secured to the drape with a towel clip. The sterile handpiece is placed on the unsterile connector. The sterile handpiece cover is then placed over the handpiece. The handpiece and the tubing are pushed through the cover. Only the sterile tip of the handpiece is allowed to come through the cover. Secure it with a sterile rubber band. Secure the bottom of the handpiece cover to the drape with a towel clip. Place light handle covers over the handles secure with a rubber band. Care must be taken to avoid contacting the light with your sterile gloves. The surgical assistant must always be aware of the sterile field and notify the surgeon of any breaks in technique, such as the hole in his glove. The circulating assistant grasps his glove, being careful not to touch his sterile gown, and pulls it off. The surgical assistant places another glove on his hand, keeping her hand under the cuff. To demonstrate sterile and non-sterile areas, we have color-coded non-sterile areas in red. The cap and mask are not sterile. The shoulder and neck area is not sterile. The hands should be kept above the waist and below the shoulders when not at the operating field. The bottom of the gown is not sterile. The edges of the patient drape are not sterile. The edge of the instrument table cover is not sterile. In a sterile field, the patient becomes the center of the field, with all sterile persons facing toward the center. A sterile person turns his back when passing a non-sterile person or area. Sterile persons must pass back to back. When wrapped items are opened, the edges of the paper are considered non-sterile. When opening sterile liquids, care must be taken not to contaminate the lip of the bottle or the inside of the cap. When pouring the liquid, care must be taken not to let the unsterile container come in contact with the sterile cup. The outside of peel packs are not sterile. When peeling open, care must be taken not to let sterile items come in contact with unsterile edges. Small peel pack items should be removed with a hemostat to avoid accidental contamination of gloves. Care must be taken not to place sterile items on wet surfaces. Liquids will soak through the paper and contaminate the inner contents. Sterile technique, whether it is in the dental office or the hospital operating room, is an all-or-nothing routine. To ensure successful surgical procedures, the chain must not be broken. We hope you have learned from this videotape and will continue to use it as a reference source when preparing for surgical procedures.